Hello, today we're going to talk about falls and fall prevention. In the pulmonary rehab program, we've covered a lot of topics from wellness and goal setting to better breathing, and many of the topics are uplifting. The falls talk is a little sobering, but I will say even in our household, we've had more than one broken wrist, and it wasn't the teddy bear from a fall. So falls do happen, and it's a topic worth certainly talking about and digging a little deeper into. So I'm going to share the screen here with the PowerPoint presentation. Yep. Try and go through some of the somewhat sobering statistics. Among older adults, roughly 1 in 4, if not more, report a fall in a given year. And although falls are very common, probably half the people who have had falls in a year don't report that to their doctor. Even more disconcerting is that every 20 minutes or 3 per hour, an older adult in this country will die from injuries related to a fall. So not surprisingly, it's a rather important public health concern, but it also affects individuals in sometimes a devastating way. Falls do increase with age, so you can see the numbers percentage-wise in a given year climb from 27 to 37% when you go from your 60s to your 70s and into your 80s. And there are some statistics that suggest race and ethnicity affect your falls risk as well. The number of falls and fall injuries is expected to climb significantly between 2014 and 2030. Big reason for that is that the number of older adults is going to climb during that time from 46 million to 74 million roughly. And that increase in the older population will result almost certainly in an increased number of falls and fall injuries. $31 billion, over $31 billion, that's the Medicare cost annually for fall injuries, and hospital costs account for well over half of that total. Injuries from falls are a major cause of loss of independence for older people, and consequently that makes it a significant public health problem. 1 out of 5 falls causes some kind of serious injury, like a head injury or a broken bones. That translates to 3 million older adults annually treated in an emergency department for a fall. There are over 800,000 patients a year hospitalized because of a fall injury. And often the most common injuries are head injury or a hip fracture. That translates to 300,000 or more older people hospitalized a year for hip fractures, and nearly every one of those hip fractures is caused by falling, quite often by falling sideways. Falls are the most common cause of traumatic brain injury as well. Falls with or without injury also carry a heavy quality of life impact. It's really a vicious cycle. If you think about it, as we become more unsteady on our feet and we fear falling or have had a fall or two, many people will consequently limit their activities and their social engagements. And in so doing, this restriction in activity can result in further, more rapid physical decline, depression, isolation, feelings of helplessness, which of course doesn't lower your falls risk. All of those things, if anything, will make your falls risk higher. These are a couple of typical quotes from people in their 70s. It's not the broken hip, it's the nursing home I fear. I want to maintain my independence. Want to be able to keep playing with my grandkids. So it's really a quality of life issue as much as anything, um, but clearly a medical health issue as well. I'm going to play a minute or two from Grant Baldwin's presentation. He's not really speaking to patients here, he's speaking to medical providers, but I think the three questions he wants every medical provider to be asked.
Routine questions are part of every medical visit. But are you asking patients 65 and older about their fall risk? 1 out of 3 people in this age group fall each year, but less than half of them talk to their healthcare provider about it. By asking 3 simple questions and taking action when needed, you can reduce the risk of falling. Some patients think that falls just happen when you get older or because of bad luck, but falls are not an inevitable part of aging. There are specific things that you can do to reduce your patient's chances of falling. Hello, I'm Grant Baldwin, Director of the Division of Unintentional Injury Prevention at CDC's Injury Center. When you see patients 65 and older, make these 3 questions a routine part of your exam. 1. Have you fallen in the past year? 2. Do you feel unsteady when standing or walking? And 3. Do you worry about falling? If your patient answers yes to any of these key screening questions, they are considered at increased risk of falling, and further assessment is recommended. To help, CDC created a simple toolkit called STEADY. This stands for Stopping Elderly Accidents, Deaths, and Injuries. The STEADY toolkit includes a wealth of information that can be easily downloaded and printed for display in your office or clinic. Materials include assessment tools, case studies, videos, and educational handouts for your patients. STEADY is based on an algorithm adapted from the American and British Geriatric Society's clinical practice guidelines. Using STEADY, you'll be able to identify patients at low, moderate, and high risk for a fall, identify modifiable risk factors, and offer effective interventions. 2 validated fall prevention interventions from the STEADY algorithm that can be easily integrated into routine office visits are vitamin D supplementation and medication management. Vitamin D supplementation has been shown to reduce the risk of falling in older adults who are vitamin D deficient and is a simple thing your patients can add to their daily routine. Medication management works by reducing interactions and side effects that may lead to falls. Effectively managing medications includes eliminating medications if there's no active indication, reducing doses of necessary medications to the lowest effective dose, and avoiding prescribing medications for an older person where the risk from side effects outweighs the benefit.
So his presentation goes on a little bit longer, but I think it's worth noting that we have a fairly robust agenda trying to educate healthcare providers in how to limit falls and keep people steady and independent in their homes, partly because it's a public health consideration and also because it has such a huge impact on quality of life. So what's the definition of a fall? You probably think it means losing your balance and ending up on the floor or on the ground. In healthcare, we actually have a definition that includes coming to rest unintentionally on the ground or any other lower surface. So for example, if I try and stand up and I can't get all the way up and I end up back down unintentionally on the bed or on the chair or on the sofa I'm getting up from, in healthcare that would qualify as a fall. There are really a list of 4 things that are important to do to help prevent falls. Probably among the most important is to talk to your doctor. Sometimes falls are a source of embarrassment, not something that people necessarily want to bring up in the context of a doctor's visit. And yet if you don't mention it to your doctor or your healthcare provider won't be able to offer you any help in that regard. Many times talking to your doctor or your pharmacist about the medications that you take, as Grant Baldwin said in the previous presentation, can help you avoid being medicated in ways that might increase your falls risk. That also would include over-the-counter medications that might make you sleepy or dizzy. And lastly, a big important validated intervention for helping lower falls risk is vitamin D supplementation, and that's one that you would want to discuss with your doctor or your healthcare provider. Strength and balance exercises can help lower falls risk. It's been shown in multiple studies. Not all exercises are alike. Some have been validated and in evidence-based studies, controlled studies shown to have a direct impact on safety and falls prevention. Tai Chi is an example that's of an exercise regimen or program which with demonstrated benefits in terms of balance and fall prevention. I show here on the slide also Otago, which was originally developed in New Zealand and has become quite popular in the United Kingdom. And the CDC has taken the Otago program and has created versions of that and validated its usefulness in falls prevention here in the US, addressing strength, flexibility, balance, reaction time, reflexes. All these things can reduce the falls risk. So as Grant Baldwin said, it's not reasonable to assume that falls are a natural part of aging. There are definitely things we can do. This quote from Thomas Jefferson, walking is the best possible exercise, so habituate yourself to walk very far. Jefferson was a lot of things: a statesman, a president, a plantation owner, slave owner. He, to my knowledge, was not a physical therapist. So before beginning any exercise program, it would be a good idea to have the blessing and the counsel of your healthcare provider, or maybe more specifically, a physical therapist. In the resource manual for pulmonary rehab in chapter 12, we include 2 articles from the National Institute on Aging. And at the end of this presentation, I include the links if you want to find that information online. The 2 articles that we include in the resource manual, are Prevent Falls and Fractures and Fall Proofing Your Home. Those 2 articles are full of lots of good information, and I'm not going to go over all of that in this presentation, but I would direct you to the resource manual for pulmonary rehab, chapter 12, or to the websites for the NIH, National Institute on Aging, where these topics are covered in great detail and very well done. What else can you do to prevent falls? Using a cane or a walker or even trekking poles if those things are prescribed. If you're going to walk for exercise, gradually increase your distance and time as your symptoms dictate. The American Heart Association recommends for most American adults to get around 150 minutes a week of some type of moderately vigorous aerobic exercise like walking. If you're going to take up walking and try and do that on a regular basis, very good idea to scope out places where you would be able to sit and rest if you get too tired or short of breath. A park where benches or picnic tables might offer that kind of repose would be worth considering. Maybe there are places in your neighborhood, or the mall is another option where there are benches in the mall, and the mall typically will be open in the morning before the shops open for people who are there just to walk. Lastly, if you're a person using supplemental oxygen, a rolling walker, one with a basket under the seat, would be a good alternative. Your portable oxygen will typically fit in the basket under the seat, or there are folks who wear their portable oxygen in a backpack. An annual eye exam is recommended. Seeing an eye doctor once a year and making sure that your eyeglasses get updated if your eye exam says you should. Be wary of bifocals and progressive lenses. These things can distort. Typically they're for up close reading and that kind of thing, but progressive lenses and bifocals can distort things. For example, down near your feet, if you're using them when you walk, and could potentially be a tripping, falling hazard. So it might not be a bad idea to have a pair of glasses which are free of bifocals and not progressive lenses. In other words, distance glasses that you use when you go out to walk for safety. Again, in the resource manual and on the National Institute of Aging website, there are many, many recommendations for making your home safer. They fall in the category of getting rid of things you could trip over, like area rugs, adding grab bars, particularly in the bathroom where there's nothing soft to land on if you do fall. Grab bars in and outside of the tub, next to the toilet, that kind of thing. Putting railings on both sides of any stairs in your home, both inside and out, and making sure you have adequate lighting, particularly if you're a person who gets up in the night to use the toilet. Night lights are a really great idea, and you want to have plenty of them and make sure they're in good working order for safety after dark. As we age, our eyes do become less adaptable to dark situations. So if you're out after dark, be also aware that your falls risk is probably increased or increasing as you age, just because of visual changes that happen. So out after dark, not a bad idea to take somebody's arm if you have an escort, just for safety. If all this talk about falls is making you a little nervous or feeling like you really should get a comprehensive checkup, if you will, for falls and falls prevention, there is a fall prevention clinic that's operated by the University of Vermont Medical Center out of the Fanny Allen campus. And your primary care provider, your healthcare provider, can refer you to the fall prevention clinic, where the multidisciplinary team, a physical therapist, occupational therapist, and a registered nurse will review your medications, review your medical history, categorize your falls risk, and offer helpful recommendations and suggestions for lowering your falls risk. I include at the end of the presentation the phone number and the website here for the Falls Prevention Clinic at the medical center. If you live alone, there's some practical tips here. Among other things, not a bad idea to have your cell phone or your portable phone with you all the time when you're moving around the house, or outside your home, even in case you fall and need help. Make sure that your phone's charged when you do that. There also are medical alert systems, the necklaces, the wristwatches that can be purchased and activated so that you can get help with the press of a button if you were to need that. And lastly, great idea to have a neighbor, a friend, a relative check in on you on a regular basis, maybe once a day, in person, by phone, email, social media, any which way, to be sure that you're having an okay day and you don't have any needs. The Center for Disease Control has a compendium of effective fall interventions. It's a heavy-duty document, probably 90 pages long. It lists almost 30 evidence-based, validated intervention strategies, typically, exercise-based strategies to help people improve their balance and lower their falls risk. This is more a document for healthcare providers than it is for patients, but it's just worth knowing that there's a whole army of healthcare professionals out there who are interested in keeping people independent and safe and steady at home, and not falling unnecessarily. And there are a whole bunch of programs out there that have been tested and validated to help in this regard. So, in summary, this set of 4 bullets really addresses the things we've talked about. Speaking up with your doctor, don't be shy, don't be embarrassed. If you're starting to be unsteady on your feet, if you are starting to hold on to furniture as you cruise around the house because you're fearing that you could fall, be sure to bring that up with your doctor or your healthcare provider to initiate the conversation to get some help, because falls, as Grant Baldwin said, are not an inevitable part of aging. Keep on moving, engage in an exercise program, check your eyes or have an annual eye exam, and make sure your glasses are up to date, your prescription is up to date if you wear prescription glasses, and make your home as safe as possible, following the tips and the advice in chapter 12 in your manual or on the NIA website. Your 2 local resources, phone numbers, and web addresses. The Falls Free Vermont Coalition maintains a database of exercise programs in various communities around the state. So you can put your town or your zip code in and get a list of things that are happening, exercise groups and other programs, fall screening, those kinds of things. Great place to start for Vermonters. And then here's the web address and phone number for the UVM Medical Center Fall Prevention Clinic. Nationally, I include the link to the NIA website, part of the National Institute on Health. This is where those 2 articles in your resource manual can be found. The National Council on Aging is also a great resource, as is all the information at the CDC describing the STEADY program. There's patient materials there, as well as materials for healthcare providers. Much of the by the numbers graphics that I use in this presentation came right from the STEADY materials on the internet. And then finally, 2 links in case you're curious about medical alert systems, what they cost, and the various options out there. There are many to choose from. So these 2 links would be a starting place, perhaps, for you to do a little bit of homework on medical alert systems if you think one might be the time to invest in something like that. So that's it. Thanks for joining me, and be safe.